Hi, Mike Gibson, Chris Wong. We're coming to you from AHA 2025, and we're talking about the DECAF study. Big question that both patients and doctors want to know, what is the impact of caffeine on atrial fibrillation? Chris, what did you do? What did you find?
Thank you, Dr. Gibson. We studied caffeinated coffee in patients with atrial fibrillation. So we recruited 200 participants who were randomized after cardioversion to either caffeinated coffee consumption, encouraged to drink at least one coffee cup per day, or abstinence from coffee, which included all caffeinated coffee and decaffeinated coffee, as well as all caffeine-containing products. We then followed these patients up for 6 months, looking for the primary endpoint of clinically detected recurrent atrial fibrillation or flutter.
What did you find?
Well, surprisingly, what we found was that patients randomized to caffeinated coffee consumption actually had a lower risk of AFib or flutter through the 6 months follow-up period. In fact, they had a 39% reduction in the hazard of recurrent AF or flutter.
Wow, I got to say that's somewhat counterintuitive. How do you explain it, Chris?
Absolutely. We were unsure what result we'd find because, as patients commonly believe that coffee and caffeine trigger their AFib. And similarly speaking, we as physicians continue to advise that perhaps reduction or abstinence may be helpful. But it does fit with observational study. There have been a number of population studies that have shown a lower association of coffee with AFib, and the mechanisms deserve further exploration. It's possible that a range of mechanisms may be at play, whether it's antioxidant effects, a lowering blood pressure due to diuresis, perhaps more physical activity, which Dr. Greg Marcus, the senior author in this study, has shown in another randomized trial of coffee consumption.
Well, you ask an interesting question, you do a good study, and you get an important answer. Well, Chris, thanks for sharing with us today.
Thanks for having me along.